Good morning, everyone. Thank you for joining us. It has been a really intense week, and I am stoked to be at where we're at right now. I can tell you that that was not the case last week. I know we had a very condensed and shortened meeting. I was actually coming to you from the University of Arizona vaccine pod on the first day. I think just to kind of give you an overview on the timeline of how the wings got put on the plane this week, I just want to take you through a little bit of that picture to hopefully help alleviate some of the confusion and bring some clarity around vaccinations for K through 12. If you're just joining us, if you could please remember to mute your microphone. Getting some background noise there. Thank you. So the first thing that I want to say before I launch into this is we weren't planning on starting 1B until February. So that's an important baseline because we're not even in February and we've gotten a lot of K through 12 vaccinated, which is good. So we launched early. We had about 3 days, honestly, to build a registration system from scratch and to try and get folks vaccinated on a pilot that originally our understanding was we were going to have 500 a day on Wednesday, Thursday, Friday, and Saturday at the U of A pod. So after a launch at a couple of other sites, we made an executive decision that we needed to scale back and we needed to make sure that all of our processes and systems were in order before we moved up to a higher capacity of vaccinating at the University of Arizona. And it's a really good thing that we did that because we ran into a lot of hiccups. We ran into a lot of unforeseen problems. We built a system in 14 days to do it. So I know it was a hassle for a lot of us. It was a lot of working days for the folks in the boots on the ground, working nights. But I feel confident that we're in a really good spot right now for where we're starting this week. So we scaled back to 132 a day for Tuesday, Wednesday, and Thursday before our automated process went into works on Friday. I had asked all of you and all of these schools to submit an Excel spreadsheet with a order of prioritization of your staff of who could get vaccinated. From there, once I get that spreadsheet, I actually have to build that into a larger spreadsheet with all the other schools that have submitted that, and then send that off in a secure file drop to ensure that it gets through to TMC. Now, the first couple of drops that we did, there were a ton of errors. If the address is not matching the zip code, if the street is misspelled, if the names are misspelled, if it's not formatted in the exact way that it's needed to actually get up and running, then that entire file is rejected and it will not upload. So after doing this 2 or 3 times, we had to create another process through our Pima County IT system to scrub that entire massive file, correct any errors through some scripting, which I was told on a call yesterday that there were up to 64 lines of script on these massive Excel files that needed to go through to make sure everything was clean enough to drop onto TMC so that people could start getting scheduled. So I'm just giving you a context as to how intensely difficult this process is overall and why there's been so many hiccups. We finally managed to get some of those scripts running and operating this last weekend. However, we found that in one of the massive files that got sent out, which included about 8,000 K through 12 educators, that there was a one district in particular where, for whatever reason, during the initial scrub, there was a shifting of last names. So if and I'm just gonna pick in the chat box here, Cameron Taylor might have gotten the email for Melissa Taylor, and Melissa Taylor might have gotten the email for Douglas Taylor, and so on and so forth down the line. Now, thankfully, there wasn't any medically compromising information on that. It just led to a lot of confusion. Because of that, TMC had to recall that 8,000 batch, and we had to go back in and add more coding into the overall system to make sure that that wouldn't happen again. So again, just contextually, this is why we have had the delay on all of this.
Okay,
Some of your
that's fine.
staff,
I'm listening
if you
to a
could
call,
please
okay?
mute your
So what do you have to work
microphones
on?
while you're on the call, that would be great. Thank you. So I'm sorry, we were saying so that there's still staff of yours that have not received an email, and there's a couple of reasons why. So if their zip code was off, if their social security number was incorrect, if there was information fields missing from any of that format, then they were pulled off and automatically dropped from the TMC thing. And then that file then goes back to our data team to rebuild and try to reconstruct to alleviate those errors and then resubmit to TMC. Okay. So our final due date for all of this process is Wednesday at 5 p.m. I want to just first and foremost say we are not going to accept any more Excel formatted files from here on out. We're going to try to stick with uploading what we currently have. We have about 10,000 K through 12 educators in the queue to get dropped over to TMC as of last night. So they're working on finalizing some of those file formats and then dropping that file. Anyone from your list that was submitted should receive an email from TMC by Wednesday at 5 p.m. Okay, so that's an important date and time, and I'll write that in the chat. By Wednesday at 5 p.m. I sent out an email yesterday communicating this same message to everyone that receives this invitation. If you please share that with all of your staff, with all of your operations facilities folks, all of your custodial staff, anyone that works to keep your site operational needs to have that message that they need to check their inbox, either their personal and their school email for a TMC MyChart invitation to fill out their account. Once they've done that, they can schedule to receive their vaccine at the University of Arizona. And this is another error that I want to go back and make sure we're clear on too, okay? So there's a lot of explaining here, and I wish there was more visual materials, but there's a lot to kind of process here. So if they do not receive an email from TMC MyChart by Wednesday at 5 p.m., they're going to go over to the Pima County Health Department website, and I'll show you how to do that in a minute. Go to the REDCap system and register to receive their vaccine through the health department. We're going to push through a lot of vaccines. We're allocating K through 12 only to the University of Arizona. We're not going to do any college, university, trade school, or early childcare at that site. We're going to just do 2 weeks straight of K through 12 starting this week on Monday. So Monday through Saturday, we want to get all your folks vaccinated and immunized at that site. There are slots open right now as we speak at the U of A for today and for tomorrow. So get your folks to make sure to check the walk-in vaccination at the University of Arizona. There's a drive-through and a walk-in. Make sure they check the walk-in for today too, because there's slots open and we can get people vaccinated today. Again, we only want to have them to the U of A. I do see a question pop up from Adnan Dorian here. Staff reports the instructions of the location for the U of A is not right. They got it to the hospital, not U of A location. Can that be corrected? Adnan, if you can forward me any communications that are communicating that to your staff, I will make sure to get to the source of where that confusion is occurring, because that is not correct. We definitely need them to go to the University of Arizona. The drive-through site is really easy to find. It's just off of University. Head south on Campbell. It's make a right on that big university, right onto the U of A mall. You drive up on the grass and get your vaccine there. I saw a lot of you from this call over at that site. Shout out to Mr. Washington and some of the other folks from Satori, and it was good to actually see some faces and put faces to the names there last week. It was fun for me. So yeah, just forward me that email, Adnan, and I will make sure we get that communication corrected. The walk-up site is the Ina Giddings building. There's 2 places to park for that, and I will make sure that we have a map forwarded to everyone for that. Next question on there, if our staff have received the vaccine through other means, should we update the spreadsheet we sent to you? No, because you won't be sending any more spreadsheets over to me at this point. My hands are completely off the process, which I got to tell you, I'm really happy about. So we'll have all of your staff will need to go to the REDCap site. Wednesday at 5 p.m. is when that's going to open, when we're going to start pulling from that. I mean, they can go to it now and enter the information, but it's not really going to be helpful to anyone. It's just going to kind of sit there, and they might have to re-enter it at a later time. So just make sure that it's really clear that they enter that information this Wednesday at 5 p.m. For those of you on the call, just another reminder, if you can mute your microphones, I am getting some background noise there. I'll see if I can alleviate the problem on my end. Here we are. Okay, there, that's taken care of. A couple of other questions in the chat here. I'll pull up that email and post it in the chat so that everyone got that. We have some staff tested positive for COVID in the past 30 days. Guidelines recommend they not receive the vaccine at the time. Correct, Mr. Olguin, that is correct. They should schedule their appointment once they get to about 70 days, more or less. They still qualify as 1B. They'll have 90 days effectively of immunity during that time. How do we know if information was correct or rejected? I'm sorry, Brother Jesus, but there's no way to know that, because once I pass it on, it's all in the hands of IT. It then gets dropped in that TMC file. Well, before it gets dropped into TMC file, it gets scrubbed. IT goes back and tries to remediate any of those errors in the meantime. I do want to point out that the biggest part of that error was me sending you all 4 separate different forms and formats. As we troubleshot through all that, and it wasn't until TMC finally gave me the exact scripting for what was needed that I sent, and I should have asked that right from the get-go, and that final version went out to all of you. That was when we started seeing those files go through correctly. So it was, a lot of it was just clerical error on our part. And again, I thank you for your patience as we work to try to get that all put together. So there's no way to know if it was correct or rejected. If it was scrubbed and pulled out, then our IT team makes the effort of going in and hand building those piece by piece. The main office corporate staff for the schools need to submit their own spreadsheet aside from the schools. Again, do not submit any more spreadsheets to me. I will not take them. They will go into my trash box. Is there a link? I'm sorry, Mr. Kidd. Are you referring to if you're referring to REDCap, there will be a link. It was sent out via that email. You just might have to copy and paste it in. Wait till Wednesday at 5 p.m. to get that link, and I will reshare that link in the chat here. It's direct on the Pima County Health Department vaccine webpage. You go there, and then there's a button that says sign up. If you get your vaccine here, you'll click that button. You'll see another button that says schools and college universities. That's the button that they're going to use to actually sign up to get the REDCap. From there, they will continue. The continual thing with all of this process is your staff will get an email from TMC MyChart to begin their registration. So that after they fill that out, the direction is still wait for a TMC MyChart email, okay? There is the information for the walk-in. It's on the U of A website. I'll post the map in the chat here. Actually, Rebecca O'Brien, I know you're on too. If you can maybe go to the Pima County link for vaccine registration, drop that into the chat. And then while Aaron's covering a couple points, I'll pull up the map for the U of A so that they know where to find the walk-in. The registration is all through the MyChart. Your staff will sign up via REDCap. The link for the walk-ups, it's all the same link. So once they build the MyChart account, they'll go to sign up to receive their vaccine. If they try to sign up at TCC or TMC or any other location, they're going to be sent back an email saying you don't meet the qualifications, you can't sign up here. So they do have to sign up for U of A. Once they click the U of A one, there's the option of drive-through or walk-up. Make sure that you check the walk-up folks. Anon, if slots are open, why not all of us can get the invitation? Most staff did not receive an invitation yet because we have a set amount of vaccines. And last week we tried to send an invite out and it ended up being a really big mess for us all to clean up. What we're going to ask Mr. Dorian or Mrs. Dorian is that we just have patience. Let us get through Wednesday and we will get your folks vaccinated. So just bear with us as we get these last few kinks worked out. I didn't get the email that you're referencing. Can you please send it to me again? I will post it in the chat, Ms. Willis, along with the REDCap site is the Pima County Health Department vaccine website, which I think Beck is going to post in the chat here in a little bit. No one on my staff received an email yet. Is this an indication that my spreadsheet was compromised? Not compromised, but data was invalidated. And it could have been submitted with that group of 8,000 that we had to pull back and then scrub and resubmit. So that's why we're saying just wait till Wednesday at 5 p.m. If you haven't received or your staff haven't received an email by Wednesday at 5 p.m., then at that point, you'll go to the health department website. All right, I'm seeing a lot of questions here on REDCap, so that tells me that I'm doing a really bad job at communicating this. So let me do a screen share and let's get that part remediated. Can you all see the Google screen that I have up right now?
Yes.
Yay, thank you. Okay, so here we are. So here's the pimacounty.gov website. You click this page right here, registration for a priority phase 1B. You'll click this button. You'll scroll down, school and child care workers. Right here is the registration. There will be a button right here on Wednesday at 5 p.m. that you can click and sign up and do all the things you need to do. So look for that on Wednesday at 5 p.m. And that's when it will pop up and activate. So this is exactly where to find it. REDCap is this system. That's the overall registration tool that we're using. So I'm going to stop using REDCap because I think that's where a lot of the confusion is coming in. And Aaron, I'm already seeing Aaron like hand to his forehead saying, oh, Brian, your communication is work on it, buddy. So go to this site. This is where you will make an appointment. School child care workers, click that button. There'll be a big button right here, Wednesday at 5 p.m. that you can click to start to register. Each individual staff that you have will need to do this process. That's again, if they have not received an email by Wednesday at 5 p.m., then they're going to do this. Make sure that they check their personal email, their spam folder, their work email, and their work spam folder, because it may have been directed over there. We've seen just a few instances of that. It's been really rare, but that's what we're seeing. Walk-up site right now is we're only looking at the folks that you have submitted as priority registration. We know again that there's been some technical glitches on that, so we're trying to remediate that. Our deadline to fix that is Wednesday. So again, if by 5 p.m. they haven't received that email, go to this site and have them start to register. All employees we submitted to you receive, yes, Ms. Willis. So that is the goal, is that all employees that were submitted to me will receive an email. We don't know if all of them will, because some may have been dropped out of the system and there's just too much errors for us to try to correct through any kind of scripting. Because we're looking at almost 15,000 folks that were submitted overall from all of the schools, all of the districts in total. So it's a lot of coding, a lot of work in the background. That's why it's that last Wednesday at 5 p.m. If you don't receive an email, you'll go to the PCHD site, correct? Yes, correct. Employees can check in at the site, can check the site for walk-ins. So let me correct that part. So U of A is only, all the sites are only by registration. We did something, oh, thank you, Ms. Geisig, for posting that too. I appreciate that. We'll repost that again in a second. We are not going to be doing any walk-ins, because what'll happen is it'll completely overwhelm the system. you have to register to get an appointment. And in order to make an appointment, you have to have an email from TMC. Otherwise, what we're going to get, and I saw a lot of this last week at the U of A, we had people in the drive-through line that were telling us that they were teachers, that they had some form of identification, but there was no registration link that we had for them, so we had to turn them away. So we're not doing any walk-ups. We only have a specific amount that we have to unfreeze every evening before we launch, and we are allocating that towards folks that have registration. For those of you on the call, Ms. McIsaac has posted the email that I sent out yesterday. Thank you so much for that. I'm gonna copy it and post it one more time. That's it. That was a huge assist. Thank you, Ms. McIsaac. Oh, and Becca's on it too. Awesome. To clarify, what is the procedure for folks who are not submitted spreadsheets? Wait till Wednesday at 5 p.m. If the staff member has received access for my chart, does it give the option for U of A pod site? Yes, that is the way that they'll have to select U of A pod site. They won't be able to get a vaccine anywhere else. And I know that there was some discrepancies on that this last week, but all of that should have been fixed at this point in time. Becca put in the link to the PCHD registration website, the site that you're seeing right now. Thank you for that. Hold on one second. I'm going to go do another mute, get some background noise here. Ah, there it is. Gotcha. Okay, no problem, Miss Willis. We live to serve. Oh, is that Tiffany? Thank you for that. Perfect. Yeah, so Tiffany just put in a script of what they'll see. That was really helpful. I will click through the site one more time for the registration, Miss Sullivan. If a person has COVID in the last couple of months, we recommend waiting 90 days. So look around day 70 to day 80 to start to register to get your vaccine, going through the process that I'm going to review one more time here. If teacher signed up at Banner as an educator but did not go through the process, will they be turned away? Banner has the option for educators. Yeah, so this has been problematic, and the Banner site is run by an organization out of Phoenix. The important thing for all of you to know is we are really trying to get our 75 and older population vaccinated. A lot of those folks have a hard time with computers. A lot of those folks have a hard time with transportation. So it takes them a little bit longer to get to the Banner website to sign up and register. If there's, say, 500 slots, or even 100 slots filled with K through 12 educators who aren't using the process that we're trying to establish, that's 100 to 500 less 75-year-olds or older that are not going to get the shot. That's problematic because the deaths in this month alone have been a record number for Pima County. And it's the majority of those folks are 75 and older. We need to get that population vaccinated. So we know that this is hard. We know that there's going to be folks that, and your teachers are scared. You all are scared. I get it. This is a crazy time. But we need to make sure the folks that are highest at risk are the ones that we're elevating and supporting as a society, as a public health issue. This is an issue of equity. It's an issue of community. We have to actively work together to make sure that we get those folks vaccinated. Okay, so it's really, really important that you all, as representatives of this process, communicate this to the people that you know. If you get an email, if you get a text from a friend, please text them back and say, hey, that's not the process. Let's not take the shot away from folks who need it. Ms. McIsaac just dropped one of the biggest problems last week that I had to deal with. So we had an issue loading one of the files over at the TCC, and we made a last-minute decision to try and get a bunch of educators over to TCC just to get a vaccine for the day. And that resulted in social media frenzy, screen sharing pictures of emails, and ended up with a line more than 200 out the door and a 2-hour wait at the TCC. the direction, Miss McIsaac, is register with the U of A. K through 12, register with the U of A. If you give us 2 weeks to get through that, we're looking at alternate site locations to get the rest of our K through 12 spread out in the community more. So we can get all of your population vaccinated, because we want schools to reopen badly. We really want that. Our kids need that drastically, and we need our teachers to be safe in order to do that. And vaccines is a great way to do that. So the direction is sign up through the process, go to the U of A pod and get your vaccination there. TMC website, the schools are not being allocated a certain number of vaccines, but all appointments are open and educators sign up. Ms. Willis, you might have to clarify that a little bit more, because all this week and all next week, there's no one else at the U of A but just K through 12. So there are a ton of open slots, and we need to get those slots filled up. So Mr. Clark, they will not be turned away necessarily, but should not use their appointment vaccine, correct? Yeah, I mean, if they've already registered with Banner, go for it. But I think I was pretty clear on my message earlier, so I'm going to stand by what I said earlier and just leave it at that. And y'all can take with that what you want to do for that. Is there a letter we can give subs that don't have a school ID? Yes. So as long as they have a pay stub that links them to the school, if they have a letter from the school administrator on school letterhead that cites that they're a school employee, we know that there's going to be some members of the community that maybe that use that same format. So try to have as much control over that as you possibly can. Those two pieces of identification will work at the University of Arizona, though. Should we send 75-year-olds to TCC if they're troubling registering? Absolutely. Yes, yes, yes. If you know folks who are 75 and older who are having trouble getting vaccinated, we can send them to TCC. I can give them a number. In fact, Rebecca, if you're still on, or Tiffany, one of you, if you can pull up that number, that it's a hotline that the county can, that 75 and older can call and get registered to receive their vaccine. So they don't have to actually do the computer thing. So let's drop that number in the chat. 65 and older is not open yet. That is category 1B.3. So we're going to get through the bulk of our K through 12 educators, the bulk of our 75 and older, and then we'll open up 65 and older. At this point, I'm going to stop talking for a minute. Erin is our main communications person over here for the health department. And I think, Erin, if you can address some of these questions that I haven't cut in yet on, and maybe talk a little bit more about either the TCC process or that kind of thing. I'm going to go on mute and let you navigate that while I pull up a couple other things and drop in the chat.
Yeah, I mean, Brian, I think one thing to keep in mind is that, Brian talked a little bit about going through this process and, the fact that registering somewhere else might be taking one of those vital vaccines away from someone else. It also basically means you're holding two spots in line, because the work that Brian is doing and the team at TMC is doing is holding a spot for that person from your staff at the U of A site. And so you're essentially standing in two lines when we're trying to get this precious resource out. A couple just points to keep in mind. Brian talked a little bit about the phone number, and I think it got posted in the chat. That's a really great resource, again, for folks that are 75 and older, or anybody else just having trouble getting registered. Now, we did just recently expand the staff and the hours for that phone bank, and so
still try to be patient. We have cut down on the waiting time that people are having to wait on the phone, but there obviously is a lot of demand. So folks might have a little bit of a wait on that phone call, but please be patient with us getting through there. We are doing media availability every day, at least through the 29th of this month, with health department and county leadership at 1 o'clock every day. And so if you're interested in kind of keeping on top of what's the latest and greatest, not just on the vaccine front, but just sort of all the other things that are going on with our COVID-19 response, every day at 1 on our Facebook page, and then on many of the other media outlets are streaming it live as well. That'll be with either Dr. Garcia or the Health Department Director, Dr. Cullen, again, every day at 1. Is there anything else, Brian, that you think I should cover today that would be helpful?
Yeah, if you could talk a little bit about 65 and older and where we're at with that, and I'll pull up the graphic of the timeline while you're talking about that.
Okay, yeah, sure. So a lot of confusion has gone on with the 65 and older group, mainly because the state has sort of a really broad definition of category 1B or phase 1B, and in at their pod sites and some of the other counties, they're handling that that group more broadly, and they're saying 65 and up. And keeping it broad. What we in Pima County decided was that as long as we had limits on the amount of vaccine we had, we were going to have to be a little bit more particular about who we were giving that vaccine to. We wanted to make sure that it was going to the priorities within that priority. So obviously, all of phase 1B is high priority. That's the reason they were categorized higher than other populations. However, knowing that we only had a small amount of vaccine, especially as we began to roll out, we knew that, just looking at our data, that the groups that we were targeting, 75 and up, has had the highest death rate throughout the entire pandemic. And so we knew that if we had to make a choice, we wanted to make sure that we were getting it into the most vulnerable arms. And so that's where some of that confusion has come from. Now, K through 12 educators obviously are also part of that high priority group, and that's why we've been putting so much work into making sure this system works. So we know we've had some holdups, and it sounds like Brian and his team, it sounds like there's some light at the end of the tunnel for some of those hiccups that we've been hitting. But again, we're trying to make sure that if we as long as we only have a limited amount of vaccine resources, that we are getting them to folks that need it most at this point in the rollout. Now, as we're able to get through larger parts of those populations, so once we've been able to cover most of K through 12, once we've been able to cover protective services and 75 and up, as that vaccine availability opens up, we'll then expand to cover all of 1B, and then on and on down the line as we can.
That was awesome, Aaron. Thank you. Clear communications, and I can learn some lessons from you for sure. So a couple questions I want to make sure I address here in the chat. I am going to go through the process one more time because I know that already I've not clearly communicated the process for U of A today, and I will make sure we talk about that in a minute here. Phone numbers be said out loud for those joining over the phone. Oh, great call. So the number for 75 and older, and man, I should have caught that earlier. Thank you, Ms. Gannon. The number for folks who are 75 and older who are having trouble on a computer, anyone who's having trouble getting registered on a computer, is area code 222-0119. I'll say that one more time. Area code 520-222-0119. Okay. And they can call that number, or they can go through the process, which I'm going to navigate you through here in a minute. All right. So anyone who's received an email already from TMC MyChart, those folks are able to schedule at any point in time. And there's appointments today to get vaccinated. So we know that there's a lot of people that have gotten an email from TMC MyChart, which I'm going to drop that email and the link so that everyone can see what that looks like when they actually get that email in their inbox. Once they get that, they can register to receive their vaccine. There's a lot of folks that have gotten it that haven't registered yet from our schools. I know that there's people that are not interested in getting the vaccine, but we have appointments here, and we need to get them filled. And I'll address your question here in a second, Ms. Musgrove, because that was part of the recall of that large batch file. Yeah, so Ms. Willis at the bottom of the chat, I put that email in there. All are appointment only. So you have to have an appointment in order to get your vaccine. But there's two ways to get your vaccine at the U of A. It's in the room and in your car. So when I say walk up, that's what I mean is you're walking up to get your vaccine. That's where the appointments are available. If you have an email from TMC MyChart that your staff haven't scheduled their appointment yet, there are appointments available today for them to go in and actually schedule that. And who knows, that may have been filled since 9 this morning because we're getting more batch drops. We cannot just send them to show up. They have to have an appointment in order to get vaccinated. Because if they don't, then we have a backfill process that we refer to so that all those vaccinations get registered. And at this point, we're no longer doing the manual registration. We did that a lot last week because I was directly in charge of doing all the registration because our automated process wasn't in place. But now that automated process is in place, if they show up without an appointment, they will get turned away. When do you know when students with disabilities are eligible for their vaccine? I don't believe there's any student eligibility at any point in the near future because I think FDA has to clear that below 18, but I'll check on that for you, Marlene. Kristen, if you're on the call, maybe you can help correct that. The link in the email says it's only good for 24 hours. That was because that was part of that large 8,000 group that got rejected from the system and that had to get a remissed email. So TMC wanted to make sure that folks still had an opportunity to register. They didn't know how many of those emails were ultimately corrupted. So they put a 24-hour expiration on it and then recalled it afterwards. They will get another invite, have them look again in personal and in their work email inbox. And they'll have that opportunity to register. There was priority in schools. It's again, Ms. Ryan, the error was in the data entry and in how the spreadsheets were populated. So an example, if there is a period anywhere in the address bar, like after street, that particular file gets rejected. If there's a comma, hyphen, a number sign, anything like that in that particular field, that entire file got rejected. So those are the examples of the details behind the spreadsheet, the Excel spreadsheet, how that got submitted over that led to so many issues with registration this past week. So if they didn't get the email, again, please wait until Wednesday at 5 p.m. Be patient with us. If they don't have it by then, that's when you will activate this next process. They will get a link again, Ms. Musgrove. Possibilities of cancellations because of weather. The U of A will not cancel. We have a firm stance from them on that. Wind, snow, rain, or hail, they are going to move forward. I've been asked if one is registered for 2 separate appointments, is it possible to cancel one of them? Yes, but you have to work with that organization. So if you registered with Banner, you have to work with Banner to cancel. You can't work with the health department to cancel your appointment. REDCap registration link is not yet available. Correct. It will go live tomorrow, Wednesday at 5 p.m. Thank you. That is correct, Mr. Olguin. Awesome summarization. TMC 75 and older. Ms. Johnson, I'm not sure if they can just show up. I think TMC is actually full right now. I think the Tucson Convention Center may be a different issue. but I'm not sure on that because I don't direct the traffic and all of that. I just I have the pleasure of just working with you all. I don't have the nightmare of trying to grasp the 75 and older population. So I feel lucky.
Hey,
in that
Brian.
sense. Yes, Aaron.
Brian, this is Aaron. One thing about the phone number, the vaccine sign up phone number, is that they can navigate, especially for 75 and older, they can navigate sites. So if TMC is full, they might be able to see if they can get them TCC, which is a really difficult part of using the website for anybody, especially for folks 75 and older. So by calling that phone number, they can actually help navigate to a site that does have appointments if there are sites that don't.
Awesome. That's good to know. I didn't know that. Good news. All right. Good. Again, Miss Stolov, if I don't know how else I can explain this. I'm sorry if I'm not communicating this correctly. There have been coding errors on the spreadsheets that were submitted. Those files have been rejected. We are working to clean those. Wait until Wednesday at 5 p.m. If they haven't gotten an email from TMC, it was because there was some kind of formatting error in how that individual was submitted into the system. At that point, if they haven't gotten an email, they will have to go through the county website to navigate that. We understand that that's frustrating. We understand that that's a really difficult thing for all of you and for all the other teachers. That's errors were going to happen. And if you need to write an email to someone expressing your feelings on that, please, I'm all ears. Yes, Wednesday, tomorrow. That's correct. Tomorrow, 5 p.m. I feel like I need to go out in the snow and hail right now, Miss Adrienne. Oh man. All right, cool. All right. So I got through the chat. I made it. I think we did it. So I'm going to go back and navigate you all really quick one more time through this this process on the website. I'm going to start from the beginning and then go all the way through. All right. So we're going to start at the pimacounty.gov website. If you put that into your search bar, just pima.gov, you'll be directed to this website. Once you get here, click the vaccine link or just the top banner right now. That's the easiest way to get there. Once you click that, it'll bring you to this page. You'll see a button right here that says registration for priority phase 1B. That's all of you, that's all your staff, all your teachers. Click that button. It'll take you to this page. Once you get here, scroll down, school childcare workers, click that button, and then you'll see this right here, okay? I think one thing that may help that I'm getting out of this right now is communication is important, right? If I did a 1-minute YouTube video that just showed you all how to navigate this, that might be one thing that you can send out to your schools. My only apprehension about that is, let's say that that just gets shared virally with everyone in the community. That could cause some folks who are not in education to jump the line, which is something we're already seeing. So I want to think more about that, work with my comms team and make sure that that's something that's not going to cause any issues. Yeah, I could stream that on Teams and share here as well. So maybe a quick navigation. This is being recorded, so you know this is something you can share with your staff. You can just fast forward to this part in the video and share that out as well. Okay, so look for that to drop in on the YouTube video today. We'll post the YouTube link in the chat here again here in a minute. Let's see, what else do I need to cover? There was a question posed earlier. I want to make sure I cover on some other issues. Oh, the other thing I wanted to show you. So U of A vaccine map. If you type in University of Arizona vaccine into Google search, this webpage will come up. And once you get here, you'll see the details about on-campus COVID-19 vaccination pod. Okay, if you click that button, I'm going to drop this link into the chat right now so you all can access that. On this as well, scroll down a little bit, download map. When you click this download map button, this gives you the entire overview, PDF fashion of the U of A drive-through site. So here's Campbell Avenue. Here's the U of A Mall. That's that big grassy area right next to the basketball stadiums over here. The tennis courts are over here. You'll turn in here. There's 2 lanes where people can come in here and get vaccinated. They're opening that up to 600 drive-through vaccinations today. Another 200 appointments for walk-ins. We're getting 800 a day, and there's plans to increase that throughput in the next week. So we're going to get a lot of y'all vaccinated through this particular area. They've done a really great job at streamlining this too. Drive-through comes in this way right here, and then you get your vaccine right in here in this spot, okay? The parking for the walk-up, which is right here at the Ina Gettings building, there's a big grass area in front of the tennis courts. So once you pull in, you'll park right in here, or you can park back here behind the Ina Gettings building as well. You'll walk up this sidewalk, turn right. There'll be folks to help direct you there as well. And then walk right in here, and this is where you'll get your vaccination for the walk in, not walk up. Again, there's that communications challenge again. I will continue to try to work on that and be a better communicator for you all, because it doesn't help when I send conflicting messages. For walk in, which again you have to register in order to get your walk in vaccine, you will need to park in this parking lot or the parking lot behind over here. I'm going to drop the link for this map in the chat as well, so you all have that. All right, so that will take care of that process. And the last thing that we're going to cover here is a couple of scenarios. All right, so I've navigated the website, navigated U of A really quick for you all so you can see where to get that. Drop the link to both the map and to the other part in the chat. Please share those openly with your staff so that if there's any confusion about where to go for their walk, where they're not in their car vaccination, they'll know where to park. Okay.
Hey, Brian, it's
yes,
Aaron again. Hey, maybe we start calling them drive-through and walk-through.
Yes, that's a great idea.
Clear.
Drive-through and walk-through.
Drive.
Awesome. Awesome, awesome, awesome. Drive-through and walk-through. There it is. And that's how the sausage gets made, folks. All right. So at the very top, there was a question. If a student tests positive and recovers, completes quarantine, and then weeks later gets another test and it's positive, but there's no illness, does the student need to quarantine again? Yeah, great question. Couple of important points. Please remember that quarantine and isolation are 2 separate things. Isolation is for a positive case. Quarantine is for anyone who has been exposed to a positive case. If you have had a positive case of COVID-19, you yourself have tested positive and it's confirmed, then you must enter into isolation for a 10-day period. Once you have completed isolation, you are free and clear for 90 days, exempt from quarantine and or isolation. There's been some issues with the contact tracing and case investigation, which I want to clarify in this call today too, and talk about where some of that issue is coming into play. So the volume of cases has been such to where ADHS, Arizona Department of Health Services, is now taking, I believe it's around 60% of our call volume for contact tracing and case investigation. ADHS is not in line with our guidance on quarantine and isolation. The health department here locally is saying that 10 days are needed to quarantine for the reduced quarantine, provided that the individual is not symptomatic or has not been exposed and is following mitigation priorities or mitigation efforts, right? So we know that ADHS, when the contact tracers, case investigators are calling, are actually saying 14 days of quarantine. This is another one of those things that is just incredibly frustrating for all of us. For now, we again are going to defer to, and we ask that you defer to whatever the contact tracer case investigator is telling the individual on the line. So in terms of how you communicate to your schools, to your populations, the health department, and Rebecca just dropped our reduced quarantine chart in there. The Pima County Health Department has been, I think we've tried to communicate clearly and follow CDC guidance. We're kind of waiting for that message to go beyond just our county. We thought we were on the same page as other entities, and it's there's just so many pieces going on, moving so quickly. It's hard to keep up to date with all of that. So if you're the difficult part is you're going to get some angry parents who are saying, you told me 10 days, the contact tracer told me 14 days. What do I do? Who's miscommunicating? You can redirect those folks over to us here at the health department. We can follow up for you. If you're willing to communicate that there's a difference and a discrepancy and when ADHS contact tracers, because they're going to call on behalf of Pima County, but you can say, we know that, 60% of the volume is going up to Phoenix. That's where some of these mixed messages are coming in, and they're trying to work on that on the back end. I think maybe we can email out some talking points. Aaron, that could be a potential communications project this week that we send out to this group and to the other groups as well. Specifically for school nurses, because I don't envy your job right now. I know that my job is difficult, but you all are the ones that are dealing with really angry parents on the ground. So I much respect to all of you and the administrators that are having to take those calls right now. I hope we can get you some talking points that can help with that. Great question from Ms. Sullivan. ADHS continuing to recommend a virtual education model for next week. Yes, I do believe that they're going to do that. We're going to the Pima County Health Department next week. We are probably going to issue some guidance around a staggered return to hybrid, and I'm going to talk a little bit about this and show some data. If you give me a second to pull this up. So we've looked at a ton of information and a lot of really important, really important stuff. Stop talking, Brian, just to talk. We've looked at a lot of information that's giving us the overall picture of where cases and how cases are happening in Pima County at this point in time, right? So what we're seeing is, oh, hey, sorry. Yeah, sorry. My son just FaceTimed me accidentally. Apologies. The positive test results right here, what you're seeing is ages 5, 6, 7, 8, 9, 10. And before I go any further, can you all see this screen share? Because sometimes I think I'm sharing and I'm not.
Yes.
Yes. Yes.
Oh, thank you. Good. Okay. All the way to ages 18, right? So this is the looking ages 5 through 18. How many of these students have actually had positive test results? So we can clearly see there's a difference between 5 to 11 and 12 to 18-year-olds. When we look at the number of tests administered, there is a curve that echoes this positive test result curve here too. What we've been doing pretty intensely over the last couple of weeks is really trying to analyze whether the reflection of this curve is based on how many people have actually been administered the test. We think that the outbreak is the number of outbreaks, which Tiffany, I believe we're currently sitting at 42 since August in Pima County. And where was I? Sorry, it's so many things going on, I get lost sometimes. We think that the number of outbreaks in Pima County are indicative of how that spread occurs within subpopulations, all right? So I'm gonna break that down a little bit more. What that means is the number of outbreaks are fairly minimal in terms of like the community transmission rates. We see less outbreaks occurring at elementary schools. When an outbreak occurs, the student who's the original positive case has already been moved to isolation. All of those close contacts have been moved to quarantine. And while they're in quarantine, they develop a positive result or start to develop symptoms. That's where the outbreak occurs. So because those outbreaks are not happening in a classroom setting, we're seeing really minimal spread in terms of an in-school setting, which means that our schools are proving to be safe places. There's a growing body of literature that supports this idea. So what you may see next week, and we will definitely make sure you all are aware of this before we issue this communication, is that the county will potentially support any K through 5 return to hybrid a little bit early. before the benchmarks move to yellow. The current guidance is that if one goes to yellow, we can support K through 5 up to potentially K through 6 return to hybrid instruction the moment that that goes to yellow. That is the current recommendation. We're thinking we can do that a little bit earlier with K through 5 because there's a reduced set of transmission factors. This is because of two reasons. One, the graph that I showed you earlier, children ages 5 to 11 are less likely to be symptomatic and therefore less likely to spread because they're not coughing, sneezing, or projecting airborne COVID particles into the air as frequently as someone who is symptomatic. The other thing, I got to close chat really quick because I'm getting distracted. The other thing that's really important to consider is that mitigation efforts in elementary settings are much easier to implement. If you tell a third grader, hey, put your mask on, they're more likely to follow that directions because of social pressures than a middle schooler. As soon as you turn around, they're probably going to take their mask off again and do it just to spite you. And I can say that because I taught middle schoolers at one point. So just keep that in mind. So that's currently where we're at in terms of that framework for staggered return. I will look at getting some of those charts out to you, men. There is some additional data scrubbing that needs to go into this before. This is just an overview for this group internally. And you'll be able to see it on the on the video when that gets launched later today. But they're not going to be publicly available at this point in terms of us like sending out an official communication. Just wait maybe for next week for that to come out. The numbers that you saw earlier were reflected from July all the way through December too. So we're going to do another analysis based on January just to see if that trend is continuing to grow. I would think that we'd see very few school outbreaks over the past few months because we have, for the most part, all been in virtual education. That is true, but keep in mind that due to the governor's open for learning educational order, that there have been schools that have been operating with anywhere from 200 to 300 students because of high-risk categories and things of that nature. So that's an additional factor to be layered in, okay? Staff member who needs to reschedule her vaccine appointment. She said she called, logged back to my chart, but isn't sure how. Can someone provide guidance? So for my chart guidance, have them call. Let me get back to you on that, Jessica. I'll email you and follow up on that because there's been some confusion on whether they call TMC or whether they call the health department, and we need to get that piece cleared up. So I'll make sure to get to you directly on that. And 10 o'clock. That felt a little longer than usual. Before we close out today, I just want to say thank you to all of you for your patience. I can't even imagine how frustrating this has been for all of you. It's been an incredible challenge. I do just have to reemphasize that we've done this in 14 days, which is really unheard of, I think. And keep in mind that we've only been experiencing COVID for 1 year and we already have a vaccine. So it's pretty amazing to think about like what we are able to accomplish as a human race as a whole. Like that to me is mind-boggling, because to get a vaccine for anything else typically would have taken like, I don't know, 5 to 10 years previously. So we've really advanced in terms of our collaborative abilities, our scientific abilities. And I'm very, very humbled and grateful to serve all of you as educators. The role that you play for our kids is critical. So thank you all for what you're doing. That concludes the seminar for today. I'm gonna stop